Hi, good morning, everybody. Thanks for joining us today. My name is Leslie Walsh. I'm a genetic counselor here at UPMC Children's Hospital of Pittsburgh, and I'll be talking to you today about what happens when you're referred to see a genetic counselor. So today, this will be an overview for patients and their families and other non-genetics medical providers. We will discuss the genetic counseling and genetic testing process. We'll review different ways to locate these services here at Children's Hospital. So we'll start by talking about who are genetic counselors and what do they do. A genetic counselor, or a GC for short, is a professional who has advanced training in both genetics and counseling, and their job is to guide a patient through the genetic testing process. A genetic counselor is someone who has received a master's degree from an accredited training program and is also certified by the American Board of Genetic Counselors. A genetic counselor can do several things. They can help you understand your genetic risks based on your family history. They can work with you and your doctors to help develop a personalized medical plan. They can enable you to make an informed decision about genetic testing. They can explain the results to you and help you process the medical and emotional implications of genetic testing. And they can also connect you to resources, support groups, and other patients. The number of genetic counselors in the US is growing. Currently, there's about 5,000 genetic counselors, and that number continues to increase every year. Additionally, the number of ways in which genetic counselors are involved with direct and indirect patient care at Children's Hospital has also increased over the past few years. Currently at Children's Hospital of Pittsburgh, we have over 20 genetic counselors on our staff, and they're part of several different divisions within the hospital. Additionally, here at Children's Hospital of Pittsburgh, we are a clinical rotation site for the genetic counseling program at the University of Pittsburgh. And some of our genetic counselors are also involved in clinical trials and research opportunities. So what might happen when you're meeting with a genetic counselor? Genetic counselors will ask about your family health history and discuss any risks to you and your family members. We'll offer continued support through the process of testing and when the results come back. We'll talk about appropriate options in terms of genetic testing and medical management. We'll help you understand available tests, possible results, and help you decide if and when to pursue genetic testing. We can also connect you to helpful resources. Genetic counseling may have a separate fee associated with it, but in many cases it is covered by insurance if that testing is recommended by a doctor. And you can verify coverage for genetic counseling services by checking with your insurance company. Currently at Children's Hospital of Pittsburgh, we have over 20 different genetic counselors who work within our division of medical genetics or other departments here at Children's. Most of our genetic counselors are housed in the Department of Medical Genetics, but we do have other genetic counselors who work specifically in ophthalmology, hematology and oncology, pulmonology, neurology, the NDRD clinic, cardiology, and more. Individuals can meet with a genetic counselor after being referred to medical genetics, or if their provider has a specific test in mind, they could be referred to genetic counselors within that special division. So what should you expect if you've been referred to see us in medical genetics? Well, medical genetics, our appointments are staffed by both a genetic counselor and a geneticist who is a physician. The appointments can be quite lengthy. Typically, we spend about 2 to 3 hours with our patients during their initial visit. First, the family meets with the genetic counselor who reviews the medical records ahead of time to make sure that we're prepared for the appointment. And then we would discuss and review the concerns that would bring a person to that appointment. We also obtain a very detailed family history. The genetic counselor will then review those concerns with the MD geneticist, and that geneticist will then examine the patient. The exam is a sort of head-to-toe exam looking for all sorts of different things that could be contributing to a possible genetic disorder. The exams sometimes include taking measurements and photographs. The geneticist then reviews their plan with the family, And it can be a lot of information. So sometimes we do recommend quite a number of labs or different imaging to help us decide upon the best test for a person. Our job as genetic counselors is to make sure that patients are informed about why this testing is being recommended and any potential outcomes from that testing. After testing is recommended, some families elect to have some of that lab work done immediately after the visit, and some families wait until additional testing is recommended or approved by insurance. Any genetic testing or DNA testing that's recommended usually requires insurance pre-authorization, and this process is variable. It can take weeks to months depending on your specific insurance. After testing is approved, we as genetic counselors can assist in arranging for those samples to be obtained for that genetic testing. Some genetic tests are done within the UPMC system here in our labs, but a lot of genetic testing is actually sent out to specialized labs around the country. Depending on the specific test that has been recommended, testing can take as little as 2 to 4 weeks or as long as 4 to 6 months to come back. Once genetic test results are received, the genetic counselor and the geneticist review those results together. Then your genetic counselor will make a plan with you to go over those test results. If the testing is negative or doesn't provide a clear diagnosis, we typically recommend a follow-up appointment where we can consider additional testing if appropriate. If the testing is positive, the family is offered the option of scheduling a follow-up visit in person to discuss those results. That can be in person here in the hospital or via telemedicine. And these results disclosure appointments are typically with just the genetic counselor, and the child does not have to be present for that appointment. So here in this list are some common indications for an evaluation to the Division of Medical Genetics. I won't go over the entire list. I'll sort of just hit a few things on this list. So we can see individuals for a known genetic condition or symptoms that are suggestive of one, or a family history of a genetic condition. We commonly get referrals for autism spectrum disorder, intellectual disability, learning disability, developmental delay, hearing or vision loss, differences with growth and development, sometimes parents just feel like things aren't fitting just right. So not all of the features necessarily fit with what the family's been informed about with their child's medical condition. And so it's our job as genetics professionals to try to put those pieces together. There are some estimates that suggest that about 5 to 15% of individuals who have genetic testing actually end up getting more than one genetic diagnosis. On this slide, we have some ways for you to contact and schedule an evaluation in the Division of Medical Genetics. We have here our main department phone number and our genetic counseling assistant phone number. In the Division of Medical Genetics, we have 15 genetic counselors and 8 MD geneticists. We routinely field phone calls from providers in our area about referral questions. We take questions from families who have been referred. And if you do have any concerns, please just give us a call and we're happy to direct you to where you need to be. Here are the amazing genetic counselors who are seated in the Division of Medical Genetics here at Children's Hospital of Pittsburgh. So now we'll talk about some of the specialized genetic counseling services at UPMC Children's Hospital of Pittsburgh. These are outside of the Division of Medical Genetics. So here at Children's Hospital of Pittsburgh, we do have a lysosomal storage disorders clinic. This is for individuals and their family members who are impacted by a lysosomal storage disorder. During these appointments, you may meet with a genetic counselor, dietitian, nurse, and you may discuss genetic testing, future risks, diagnosis, education, various research studies and opportunities, and more. We also have a clinic for the inherited disorders of metabolism. This is housed within the medical genetics department here at Children's. This is a multidisciplinary clinic where you may also meet with a nurse, a dietitian, social work, MD geneticists and genetic counselors. And common indications for referrals to this clinic include an abnormal newborn screen, and abnormal blood work that might have been recommended by a specialist or a pediatrician. Sometimes, while children are admitted to the hospital, a concern for a genetic condition might arise. Common indications for inpatient genetic counseling might be congenital anomalies or birth defects, possible inborn errors of metabolism, or family history of a genetic disorder. We have 2 dedicated inpatient counselors who are housed within the Department of Medical Genetics. I'm one of those inpatient counselors. The inpatient genetic counselors assist physicians in reviewing the benefits and limitations of genetic testing as part of an inpatient's care. And then we provide those genetic counseling services to patients and their families who are admitted to the hospital. If you think that your patient might benefit from an inpatient medical genetics consult, you can page us through the hospital operator, or you can reach us by our pickle phone. We're happy to answer any questions that you have. We also have a genetic counselor in the cardiology clinic. Common referral indications for Cardiovascular Genetics Clinic include a family history of an inherited cardiac condition, or a child who's been diagnosed with certain conditions that might have an underlying genetic component, such as a cardiomyopathy, an abnormal heart rhythm, or dilation of the aorta. Appointments are available in this clinic based on the indication and whether or not genetic testing has already taken place. You may meet with just a genetic counselor or a genetic counselor and a cardiologist. To schedule an appointment in this clinic, we have the phone number here on the screen. We also have a Plain Communities Outreach Clinic, which helps to care for an underserved population of our local Amish and Mennonite families in Western Pennsylvania. We are part of the Plain Communities Consortium of clinics, which offers primary and specialty care to this population across 8 different states. This is also a multidisciplinary clinic that can include medical genetics, genetic counseling, neurology, nutrition support, and additional services as indicated. There are also a number of research initiatives and free testing available to some individuals. We also have genetic counseling services available in the Sickle Cell program, which is one of the genetic conditions found on the Pennsylvania newborn screen. This clinic has physicians, clinical nurse specialists, social workers, behavioral health specialists, and genetic counselors to meet with families. And now I'm going to turn it over to my colleague, Charlotte Skinner, to take you through the rest of the specialized genetic counseling services that we offer here at UPMC Children's Hospital.
Hello, my name is Charlotte Skinner, and I'm also a genetic counselor here at Children's Hospital of Pittsburgh, and I work mainly in the genetic testing clinic, which I will go over in a few slides. So I'm just going to pick up where Leslie left off. So continuing on, we have a genetic counselor who works in our pediatric sickle cell clinic. So sickle cell is one of the genetic conditions that is tested for routinely for newborns who are born in Pennsylvania and many other states. So oftentimes people don't even know what newborn screening is. So genetic counselors can help explain kind of how a patient got there and what the next steps are. So this clinic is meant to meet the needs of patients who have sickle cell disease in terms of their own specialty care within hematology and other specialists, and also in terms of recurrence risk for future children or family planning, and also kind of getting children ready to kind of take the reins when they get a little bit older and need to manage their own care. We also have a pediatric cancer predisposition program, and so this clinic is located in the Hem/Onc outpatient unit here at Children's Hospital Pittsburgh. And the main purpose of this clinic is to serve patients, children and young adults, usually under the age of 20, who either have a personal history or diagnosis of a cancer or some kind of tumor, especially if it's unusual for their age. Also, there are times where healthy children will come in who haven't had cancer but may have a family history of a cancer syndrome that might make them eligible for screening at an earlier age. And then children and young adults who are diagnosed with a genetic condition through genetic testing can also benefit from seeing the counselor and the physician in this clinic. So here are just some of the indications that may bring a child to the Pediatric Cancer Predisposition Clinic. So a young age of diagnosis or kind of unusual types or rare types of cancers may be one reason. Having multiple cancers throughout the body can be another risk for a genetic condition underlying that. Family history and some other non-cancer related symptoms that can go along with certain cancer predisposition syndromes. Next, we have a great group of genetic counselors in ophthalmology genetics. They meet with patients who either have a history of some kind of ocular or visual system condition, or who may have a family history of such conditions. So they can meet with families to discuss the genetic testing that may be helpful for guiding their care and their medical management by arriving at a very specific diagnosis. And they can also offer ophthalmology and optometry evaluations and specialized testing that may need to happen for patients with particular symptoms or presentations. They do have pediatric referral clinic, and they also can see adult clinics, which are listed in the top right of this slide. Additionally, it looks like they also offer low vision service coordination for patients who may need that accommodation. So next is the genetic testing clinic. This clinic is a little bit different in terms of the model. So this is a genetic counselor only clinic. We see patients independently of a physician, but we work very closely with specialists who have a particular condition or test in mind that they would like to order targeted testing for. So we provide the genetic counseling for those patients and work closely with the specialists throughout the testing process and on the back end with results to help make sure that they know they understand the results and that they're all tucked in once they've gone through that process. So this clinic is really meant to improve access for patients who may need targeted genetic testing. So maybe they just see one specialist, like a neurologist, for example, and they have a condition like epilepsy where they have seizures. That's a more targeted indication. So they may not need the full medical exam that comes along with a Division of Medical Genetics appointment, and that specialist may know what kind of testing they want to order. So that's really the patient population that we are specialized for. If patients are more complex, like if they see multiple specialists and a physician is really not quite sure the best approach for testing, we do recommend a full exam through the Division of Medical Genetics. And we also help kind of serve as a bridge as well for that. So if we feel like a patient comes to us and they seem a little more complex after that first look, we also work closely with the Division of Medical Genetics. So visit with the genetic testing clinic, what can you expect? So similarly, in some ways to what Leslie described with medical genetics, we will collect a family history and ask some questions about a patient's personal and family history in terms of health information. We also help explain testing. We navigate kind of choosing a good lab and the most comprehensive option for a specific indication like epilepsy. And we also help with the insurance authorization process and help coordinate the testing along the way logistically and kind of with sample collection and all the things that go along with that. And then we also support and communicate with the referring physician when the results come back. So this clinic is located at the main hospital. There are a couple of satellite clinics that are not currently up and running right now, but with COVID, we've kind of limited our appointment locations. But right now we do see patients at the main hospital and via telemed. Appointments are available same day fairly often. We try to be available short term. So if you see a specialist and they want to order a genetic test, we can sometimes see patients the same day, and the discharge staff can schedule you in that clinic as long as your physician recommends that visit. So discharge staff can schedule. Providers can reach us on our Pickle line, which is at the bottom in the middle. And then patients can also call the number listed there if they'd like to request appointment at a later date for like a future appointment, not a same day. This is the 5 genetic counselors who work in the genetic testing clinic. And then we have the Neurogenetics Clinic, which is really a specialty clinic that involves meeting with a neurologist and a genetic counselor. And this is really for patients who specifically have some kind of indication that suggests that they might have an underlying genetic condition that's related to neurology. So we see people in a fairly targeted way. The clinic, so ways that patients may be referred to this clinic, oftentimes we see patients who do have epilepsy, and sometimes it's difficult to control. Genetic testing can be extremely helpful in this case. Movement disorders are another area of patients that we may see. And then sometimes based on things like your MRI, brain MRI imaging, that might suggest that there's some kind of patterning difference that might suggest an underlying neurological condition. So we will see patients, again, collecting family history, asking some targeted questions, helping to choose the appropriate test strategy, working with the neurologist, the insurance authorization process, and then all the way through results. And then on the back end, we will also help coordinate with the referring. Usually it's a neurologist who refers to this clinic. So we'll help to make sure that someone's tucked in with all of the needs that they may have based on their genetic results. And then also sometimes, even though we deal with mostly patients who have a neurological indication, we do also see kind of multi-system patients as well. So we will make appropriate referrals for all of those non-neurological assessments as well. And we see patients most Mondays from 9 to 4 p.m. At the Pine Center in Wexford. And in terms of scheduling, the best way to schedule is for a referring provider to send a request within our Cerner electronic medical record system to the neurology scheduling pool, and a neurology scheduler will then reach out to the patient to set up that appointment. And if a referring provider is uncertain, they can also reach out to Dr. Deepa Rajan or Dr. Alexis Franks to see if this will be the right clinic for this patient. And this is our team in the Neurogenetics Clinic. So Dr. Rajan, Dr. Franks, Christine, and myself. Next, we have another specialized neurology clinic, which deals with neuromuscular conditions. So in this clinic, it's a multidisciplinary clinic, meaning that there are multiple providers that can help kind of provide the most holistic, all the coordinated care that a patient with a neuromuscular condition might need. So a neurologist, a genetic counselor, Deanna Steele, that's her picture there, a pulmonologist, physical medicine and rehabilitation, physical therapist, and a nurse practitioner. And the contact number for scheduling is up on the screen on the right. Next, we have the Cystic Fibrosis Clinic. So this clinic, similarly to the Sickle Cell Clinic, children have newborn screening for cystic fibrosis in Pennsylvania and in most other states. And so when their newborn screen comes back abnormal, we will see patients for confirmatory testing. So they need some follow-up diagnostic testing after that initial screen to see if they do indeed have cystic fibrosis. And also there's a genetic component to that particular newborn screen. So in this clinic, they'll be referred for a pulmonology appointment, and they'll have a sweat test. And then they'll also meet with a genetic counselor who can go over the family history, discuss the results of the newborn screen, and talk about any additional genetic testing that is recommended by pulmonology. And the nurse coordinator's number is down on the bottom in the center. Cystic Fibrosis Clinic team, so Dr. Daniel Weiner is the physician that heads that clinic. And not pictured is Janice. She's our lovely CF program coordinator. Okay, and then we have a few clinics coming up that are not directly located at Children's Hospital of Pittsburgh, but are affiliated with our clinics. So the Primary Care and Precision Medicine Clinic is actually a fairly new clinic, and the main kind of focus of this clinic is multidisciplinary primary care. So just like when you go see your PCP for any kind of condition, you need someone who kind of keeps all your care in one place, helps you kind of navigate all the different things you may need. And so this clinic, Dr. Mylinda Massart, she has some background in genetics, and she's a primary care physician. So she really can help navigate some of the important elements of primary care when a patient does have a genetic disorder. So this clinic, some of the patients that are a good fit for this clinic are patients who may have questions about personalized medicine. So as we continue to improve genetic testing, we have precision medicine based on certain genetic markers. One example of that is in pharmacogenomics. So pharmacogenomics is basically the idea that we can use certain genetic markers to help with best practices for prescribing certain medications. So understanding how a patient may respond differently based on their genetics. Patients who have undergone direct-to-consumer genetic testing and gotten some surprising health information that maybe they weren't completely prepared for or they don't know how to navigate, that's another patient that would be a good fit for this clinic. And then certain adults who have a genetic condition and really just need someone to kind of act as a liaison for all of their specialty care, that's another good patient for this clinic. So multidisciplinary care at this clinic is provided by a team including Dr. Massart, who is the physician, and then Philip Empey, who is in the pharmacogenomics area, and then Luke, who is the pharmacist, and then Chris and Natasha, who are genetic counselors who help in this clinic. Also on site is nutrition and social work for other needs. This is the location of the clinic and also the appointment information if you have questions. And then lastly, our other UPMC affiliated genetic counselors who don't work directly within Children's Hospital, but we do work closely with to coordinate entire families' care. So we have our lovely prenatal genetic counseling and adult genetic counseling over at UPMC Magee Women's Hospital. So adults and couples who might have a family history of a genetic condition may have something come back when they're pregnant and they need additional counseling regarding that, abnormal ultrasound findings, or an interest in carrier testing or screening. And then there's also an adult inherited cancer predisposition clinic over at UPMC Hillman Cancer Center and at UPMC Magee Women's Hospital. So this is for adults over the age of 18 who either have some kind of strong family history of cancer, maybe they have a lot of people in their family who've gotten breast cancer at a young age, for example, or colon cancer. And so they will see these patients for care from counseling to risk assessment based on family history to any genetic testing that may need to be offered, and then coordinating management. So the scheduling numbers again are at the bottom there. So with that, I want to thank you all for your attention. We hope today that we've been able to provide kind of a quick overview of all the different ways that genetic counselors are involved in patients' care in the UPMC system. We'd love to take any questions. So if you have questions, you can type them into the question and answer, and we will be happy to take those questions now. So Leslie and I can help explain things. All right, let's see. Okay, so looks like we have a few questions. So one of the first question is, how many genetic counselors work at Children's Hospital of Pittsburgh? So I think there's over 20 at this point. So there's a big group of us. Do I have to have my physician refer my child for a genetic evaluation or genetic testing? The answer to that is yes. Your physician should refer you, whether it's for the Division of Medical Genetics or to the genetic testing clinic. Now I would say for the individual specialties, sometimes those physicians are working directly with a genetic counselor. So for example, in the cardiology clinic, they may see a patient that needs testing, so they can be the one to refer and navigate that process. Is that, I don't know if I'm missing anything.
No, that sounds about right. If you're interested in genetic testing for your child, that's something that you can definitely talk to their pediatrician about, or any specialist that they see. You're also welcome to reach out to the Division of Medical Genetics for any questions, and we can try to help navigate that process with you. That phone number, if you have a pen, is 412-692-5070, and we're happy to help answer any questions there.
Yes, it can definitely be confusing. So if you're having trouble navigating and you're like, I think we need to be seen, but I'm not sure, always reach out. I'm going to take the next one. I think we're on. Yeah.
The next question is, what if my child needs to see more than one specialist at Children's Hospital of Pittsburgh? Can they see other specialists? Yes, so if your child does see more than one specialist and you're interested in genetic testing, I think that the Division of Medical Genetics would be a good place to start for genetic testing. Also at Children's Hospital of Pittsburgh, we do have visit navigation services. So if you are a return patient to the hospital and you have lots of appointments to make, you can reach out to our visit navigation service. That information can be found on the Children's Hospital website. And those folks are wonderful, and they can help schedule multiple appointments on one day to try to make things more convenient for you.
Okay, so the next one is, what if my child is adopted? Does this make it harder to diagnose a genetic condition? So we do frequently have lots of different family structures as genetic counselors that we work with. And so if your child is adopted, we can still often do any genetic testing that would be done for a child who is not adopted. There are some limitations for certain tests, but we're happy to navigate those with you and explain all of those limitations. That's part of what we hope to do anytime we do any kind of testing, is let you know, one, what it can do, and one, what it can't do. But there is no reason a child who is adopted can't get the same quality genetic counseling and testing as any other child.
Okay, lots of great questions today. Our next question is, what if my child is diagnosed with a genetic condition? Will my other children need to be tested? So that depends on the specific genetic condition. When we talk about genetic testing, we are talking about our DNA, and we know that our DNA comes from both of our parents. So that means that some things can run in families, meaning that other family members, like brothers and sisters, parents, cousins, could also be affected. But there are some cases in which genetic disorders occur for the very first time in a child. So maybe other people might not need to be tested. This would be a great appointment, a good referral for genetic counseling, so that we can review that specific condition with you and review if that's something that other family members might be at risk for.
Okay, and then we have one more right now. With COVID, do you offer appointments by video? So in many cases, it is an option to do telemedicine right now. I would reach out to the specific department that you'd be getting the appointment with, just to make sure that that's something they're offering, but it is often an option right now.
Our next question is genetic testing expensive? So in many cases, genetic testing is covered by insurance, and that's one benefit of coming to Children's Hospital of Pittsburgh for an appointment with a genetic specialist and a genetic counselor. When we order genetic testing, we do believe that there's a medical necessity for that genetic test, and so we do our best to make sure that that's covered by insurance before we send that test. We do also provide other resources for you to check your out-of-pocket cost before proceeding with that genetic testing. Without insurance authorization, genetic testing can be quite expensive.
Okay, we have an interesting question. Can you interpret my 23andMe results? So at the Children's Hospital of Pittsburgh, in the genetic testing clinic and in the Division of Medical Genetics and the other clinics located here, I would say that this is not something that we specialize in. But the primary care precision medicine clinic can help you navigate some of the health information that can come back from that testing. So in terms of 23andMe, it's kind of broad. So some things are related to health, other things are related to ancestry. So for some of the health implications, such as like breast cancer risk, one of the genetic counselors in the primary care precision medicine clinic would be happy to let you know if there is a need for additional testing or if there is something you should be referred for in terms of a specialist clinic.
Our next question is, do you have a clinic to see Amish patients? Yes, we do. We do have a Plain Communities Outreach Clinic. So in order to facilitate an appointment for families of Amish or Mennonite background, you can call the main division phone number for medical genetics, which is 412-692-5070, and let them know that that is the specific appointment that you'd like to make. And we'd be happy to help facilitate that with our specialized Plain Communities Outreach Clinic.
Okay. So the next question is, genetic testing seems scary. What if I find out that I passed a condition on to my child? So genetic testing, it can be a little bit scary, especially if you're not sure what to expect. So part of our job as genetic counselors is to help make sure that it's not so scary, that we have a conversation beforehand about what we could find, about with all the things that we want you to be prepared for in terms of results. And then also a big part of our job is finding resources for you once you do find out difficult information. So there are tons of great organizations all around the country, all around the world, different registries for rare disease, and family groups, parent groups, different support resources and informational resources. So our goal is always as genetic counselors to make sure that even if information is very difficult, that you have the tools that you need to adapt to those results. Did you want to add anything to that, Leslie?
No, I think that's great. That's exactly what we do as genetic counselors, like Charlotte said, is to take that information and help it be less scary for you. Our next question is, why is it important to make a genetic diagnosis for my child? What difference will this make for my child and my family? So it's helpful in a lot of cases to make a genetic diagnosis because that kind of gives us as much of a crystal ball as we can about what to expect for a person going forward. For example, are there other specialists that they need to see to stay on top of any health problems that might come up in the future? Is this something that potentially they could pass on to their children that they would need to know about for their own future? And what difference does this make for my family? A lot of times things are inherited or passed through families. And so in some cases, that means that other family members might also be at risk. And so we can help with what we call cascade testing, which is helping other members of that family to understand their risks and consider genetic testing. Additionally, a genetic diagnosis in some cases helps unlock certain services for individuals. For example, if they have a genetic predisposition for something like a learning disability or a developmental delay, having a genetic diagnosis may make it easier to secure things like extra services at school or therapies.
Okay, if I have a child with a genetic condition, will all my future children be affected? So this is a really good question, and one that almost every parent that comes into a genetic counseling session usually wants to know. And the answer is that it sort of depends on what we're seeing. So when we do genetic testing and we diagnose a genetic condition based on that testing, we can then know what pattern that condition looks like when it runs through a family. So certain conditions may have a higher chance of affecting future children, and others may have a lower chance. So one of the things that genetic counselors do as part of your session is to give you that full risk assessment so that you understand what those future chances are that you could have a second child that has the same condition.
Okay, our next question is, if I'm worried about having another affected child, can I have testing with my pregnancy? Where would I go to do that? Great question. So if you do have a child who has a genetic condition and you'd like to talk to someone about risks for future pregnancies, we would recommend talking to our great colleagues down at Magee Women's Hospital in the prenatal department there. There are lots of options for preconception testing, so that would be carrier testing for parents, things like testing during pregnancy, chorionic villi sampling, and amniocentesis. And in some cases, there are ways to do pre-implantation genetic diagnosis with IVF, and all those options can be discussed with our prenatal colleagues at Magee in more detail if you're interested.
Okay, I think that looks like all the questions that we have right now. So I think we'll go ahead and end it there. If anybody does have questions, or if you watch this later and you have additional questions, please use the resources throughout this slide presentation in terms of the contact numbers to reach out. We're always happy to hear from patients and help navigate. Thank you so much for tuning in, and have a lovely day.
Bye-bye.